Hello.
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 Hello, my name is Alison Hicks.
My name's Rebecca Gash.
My name is Eva Bannister.
Hello, my name is Janine Hicks.
My name is Eleanor Lawson and I'm an occupational therapist.
I'm a mammographer.
I'm a dietitian
I'm an advanced physiotherapist.
I'm a diagnostic radiographer at Royal Lancaster Infirmary.
at Royal
Lancaster
Infirmary. I work with acute stroke patients, stroke rehabilitation and early supported discharge.
We x-ray patients all over the hospital, sometimes on the ward if the two polys come down to us, and also in theatre as well when patients are under anaesthetic.
We look how they are managing in hospital, we'll assess them.
I see a huge variety of patients, anyone with artificial feeding, anyone who's generally malnourished.
If it's just a screening day, then we could probably see up to about 100 ladies in a day.
And together, interprofessional working, we put together a rehabilitation plan.
Also we can have a quick look at them, see if there's any obvious fractures and things.
We just changed the diabetic menu slightly in hospital and things like that.
In the mornings we come in, we do the QA of the machines just to check that all the machines are working effectively.
Might look at their roles and their habits and just make sure that they're able to do these things before they go back home.
And us having that in-depth knowledge, being able to give people a quality of life back.
Hello, my name is Linda Womack. I'm the Allied Health Professional Lead for the Trust. Allied Health Professions are made up of 9 different bodies. In our Trust we have radiographers, physios, OTs, dietetics, occupational therapists. We also have speech and language therapist staff that we work with from the community teams. They aren't doctors, they aren't nurses, and actually they are professions in their own right. They do get frustrated that everybody ever talks about doctors and nurses because they do play a very crucial role in the organisation. They work on the wards with our nursing staff and our clinicians, and that they regularly attend MDTs, they regularly attend the board rounds, so they are involved in patient care up front. I think I would class our AHPs as our unsung heroes of the organisation.
I was a personnel administrator for 8 years in the Royal Air Force. I played a lot of sports.
Well, I've always been interested in food and science and things like that when I was at school. Going into the NHS fitted in well with that.
And when I was training, I worked in mammography as a clinical support worker. I've also had family that have had problems with breast surgery.
So I had an x-ray one day and I thought it was quite interesting.
It was from going to a careers fair that I found out about OT.
And when the opportunity came up, then I just took it.
I kind of fell into physio when I did my work experience.
Pursued it from there and then started the degree.
You have to do a 3-year BSc in diagnostic radiography. It has to be a Healthcare Professionals Council approved course. I did mine at Liverpool.
Did a 4-year degree and then qualified as a registered dietitian.
Firstly, I attended a course at University of Cumbria for 3 years to be a radiographer, and then after that I went to University of Salford to become a mammographer.
I'm a radiographer by profession. I actually started off in the NHS, went into the military, and then I've joined the NHS again, and I've worked for Morecambe Bay for the last 12 years in various roles. It's more difficult to recruit the more experienced staff. We have grown our own, we have put our staff through training, we have supported our radiographers to become sonographers. They are involved and they're crucial to our organisation to make it run smoothly. Recruiting staff is also helped if we have a proper structure in place, and actually there can be career development for our staff. We need to increase the number of advanced practitioners we have across the organisation and use their enhanced skills to help patients. I think the best bit about my job is that actually I don't know what's going to come in on a day-to-day basis. I like the challenge of the unknown.
Seeing lots of different patients, that every day is different.
I absolutely love patient contact. When there's a poly patient and you know you're helping them in their care pathways, it can be really rewarding.
In breast screening you have a little bit more time to interact with the patient.
Seeing a patient through their journey in hospital, helping them get better through nutrition. Probably my personal favourite part of the job.
Sometimes they come in, they have the mammograms, you see them through the ultrasound, they have the biopsy, so you can build up a rapport with the patients.
We can get patients home, and that's generally what patients really want when they're in hospital.
And working with those patients and giving them that empowerment back. It's not just about what we can do, it's about getting the best out of the patients that we can.
Even a bit of equipment, and that makes a difference. They can then manage this activity at home.
Over the last 12 months, I think the developments we're probably most proud of is our early supported discharge. It has made a massive difference to our patients across North Lancs. We've been able to get them home much quicker than they would have done previously, with physio and OT support at home, some speech and language therapy from our community teams. We have now got supported discharge in some of our orthopaedic patients. We're taking them home several days quicker than we would have done previously. The comprehensive geriatric assessment, so assessing patients over the age of 75 when they come in to make sure they're getting the right care and the right treatment much earlier. I think the next big project for AHPs will be Better Care Together, and that's going to see us working in a completely different way. We need to be more flexible to see patients in different settings as well. That is our next big challenge.